Welcome, everyone. I'm Valentina Kutyifa from the University of Rochester Medical Center in Rochester, New York. And I'm delighted to be here today to share some of the findings with you from the BIO-LIBRA study. The BIO-LIBRA study is filling an important gap in clinical evidence. We know that patients with non-ischemic cardiomyopathy have been shown to benefit from the ICD, but many of these studies were conducted more than 20 years ago. Since then, there have been significant changes in medical therapy, and now we extensively use cardiac resynchronization therapy as well. So there has been lots of improvements in clinical outcomes of these patients. And more recently, the Danish trial challenged the benefit of the ICD in non-ischemic cardiomyopathy patients, but Danish was conducted in a single country in Europe. So some of those findings may not be applicable to patients in the United States. So therefore, we designed the BIO-LIBRA study to prospectively look at the rate of ventricular arrhythmia events and mortality in a large cohort of patients with non-ischemic cardiomyopathy and primary prevention ICD or CRT-D. And all of these patients were enrolled from the United States. First of all, we know that women more often present with non-ischemic cardiomyopathy. But the challenge has been that females have been historically underrepresented in device trials. So the BIO-LIBRA study had a specific focus to look at the characteristics and the outcomes of female patients and to ensure that we can do a proper analysis of both females and males in the study. We pre-specified and encouraged and helped the sites to enroll at least 40% women in the study. So we have an appropriate number of women and men as well to look at the characteristics and the differences as well. The BIO-LIBRA study enrolled 475 women out of the 1,000 patients. So the female enrollment was 48%. And what was really interesting is that when we increased the enrollment of women, we also increased the representation of different races and ethnicity. In BIO-LIBRA, we had 30% of the patients who self-reported to be non-white, and 10% of the patients self-reported to be Hispanic. Now, we found some really interesting differences in the characteristics of females and males in BIO-LIBRA. While the age was similar in both groups and left ventricular ejection fraction was similar as well, we found that women presented with more advanced heart failure symptoms at the time of ICD implantation. Women reported to have a New York Functional Class 3 symptoms in 55% as compared to 46% in males. On the other hand, males more frequently had atrial fibrillation in the history. So they had some sort of atrial fibrillation episodes prior to receiving the device. When we looked at medical therapy, reassuringly, we found that most of the medications were similarly used in both men and women. Beta blockers were used in 92%, about the same in both groups. ACE, ARB, or ARNI was surprisingly only used in about 80%. But again, there were no sex-specific differences. We found, however, sex-specific differences in the use of diuretics. Women were prescribed diuretics in 79%, compared to men who were prescribed diuretics in 71% only. And this is likely to the more advanced state of the disease in women. The key findings of the BIO-LIBRA study that in a large prospective cohort of US patients with non-ischemic cardiomyopathy implanted with an ICD or CRT-D, we found and reported a high risk of ventricular tachyarrhythmia events with implanted devices. The residual risk of VTVF when detected by the ICD was 14% at 3 years. And these patients had a relatively high rate of mortality as well. The 3-year mortality rate was 12%. And when we looked at the sex-specific differences, we found that females were significantly less likely to have ICD-detected VT or VF events. And women also had lower mortality when we looked at the Kaplan-Meier curves, but when we adjusted for these differences in clinical characteristics, this difference was no longer observed. Yes, we had some really interesting findings that were completely unexpected in BIO-LIBRA. We enrolled a large cohort of patients of both females and males and representation of different races and ethnicities, and also about an equal number of patients with an ICD or CRT-D. And in BIO-LIBRA, we report a significant interaction between sex and device in the study. And that's really interesting. And what we found that women with an implanted CRT-D had the lowest rate of ventricular arrhythmia events as compared to women with an ICD or men with either an ICD or CRT-D. We also found a significant interaction with race that was also completely unexpected. And very interestingly, we found that Black women had a very high rate and a very high risk of ventricular arrhythmia events that was similar to the risk in Black men and white men. On the other hand, white women had the lowest rate and the lowest risk of ventricular arrhythmia events. And this is definitely interesting and may need future confirmation, but we feel confident about these findings because we had a relatively large number of patients in each of these groups. The findings from BIO-LIBRA are importantly reassuring with regard of the benefit of ICD in patients with non-ischemic cardiomyopathy. Why this was not a randomized clinical trial, we have reported and observed a really high rate of ventricular arrhythmia events and a high risk of mortality. We also show different risk and different outcomes in females and males with different devices and reporting different races. So this could help clinicians identify those who are particularly high-risk patients, such as Black women, and particularly low-risk patients, such as women with a CRT-D. So this is certainly helpful when looking at the future risk of these patients when they are getting their devices. So future studies confirming these findings would be definitely helpful. BIO-LIBRA only enrolled patients with non-ischemic cardiomyopathy, so it is unclear whether similar findings could be revealed if patients with ischemic cardiomyopathy are studied. So these are certainly some of the future directions.